to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we are talking about bile and gallbladders and the importance of them. Let's get straight to our viewer questions now. Doc, Sherry from Santa Rita asks, how do I know if the nausea, gas, and bloating I feel after eating a fatty meal is a symptom of gallbladder problems, or if it's just associated with that fatty, greasy meal I ate?
Yeah, that's a really good question. Sometimes it's hard to tell, but if it keeps happening after many fatty, greasy meals, and especially if you're experiencing pain, not just bloating and indigestion, but actual pain or even vomiting, then it's more likely due to your gallbladder. But sometimes it's a little hard to sort out. So one way you might try to do it is adjust your diet and see if anything changes. If it still doesn't change, then it probably is your gallbladder.
Vanessa from Timoning writes, my gallbladder has been removed. Why do I still have those symptoms such as nausea, burping, bloating, gas, and pain?
Well, you may have some other digestive issues. Some people have what's called irritable bowel syndrome. Maybe sometime we'll do a show on that. And that's very common. And people have basically constant digestive problems that are not related to any organ. Every test that's done is normal, but they still have problems with food. And so that's something that would be checked out. And occasionally there can be complications of gallbladder surgery where there's some stones left behind in the wrong place near the pancreas. And that's another possibility. So if you're having problems, please go get checked.
Craig from PD asks, what kind of diet should I follow since I've been diagnosed with gallstones or gallbladder problems, or if my gallbladder has been removed?
Right, so we were just talking about that. Sometimes after the gallbladder is removed, people have some adjustment time where they will have a little bit of diarrhea because the bile is constantly going into the guts instead of being stored and just squeezed out when you eat. So they may have a little bit of adjustment time, but that's usually just a couple of months or so, and then they're back to normal and your body can live without a gallbladder, no problem. But, you know, as far as the diet, again, staying away from deep fried foods, greasy foods, large chunks of steak with fat and so on, that would be very important for you.
All the good stuff,
yeah.
Right? All right, Christina from Manila asks, what are the side effects, if any, of gallbladder surgery?
Oh, okay, well, there you go. Well, as in any surgery, you can have a complication. Generally, gallbladder surgery is incredibly safe. It's commonly done now almost as an outpatient, basically same day in and out, and through the little keyhole that we were talking about. But you can always have a complication of bleeding, of infection, of a problem where there's a blockage. So things can happen. I think the biggest complication is when it can't be removed through the little keyhole and an actual big incision has to be made, and then the recovery is almost a month. But that's very uncommon. So don't be afraid to have your gallbladder taken out if it's something that your doctor recommends.
Okay, and we mentioned this a little bit earlier, but Marianne from Santa Rita asks, she thinks that she might have gallstones. What are some symptoms, the telltale symptoms that she should look for?
Right, so again, pain on the right side of your rib cage, especially after eating a fatty meal, radiating to the back or even up to your shoulder blades. Sometimes the pain can really be very intense, and it's a squeezing kind of pain. It comes and goes, and people feel very sick. They vomit. In severe cases, they may even have a fever. And sometimes it's just burping and bloating and indigestion, as we mentioned. So the way you diagnose gallstones is with an ultrasound of the abdomen. And with that, they can see the stones inside.
Okay, and our last question comes from Stephen from Agate. He says, what is a gallbladder live flush and how effective is it? And I'm assuming this is to clean it out?
Yes. There are many herbal remedies that people have tried over the years to get rid of those stones, hoping that the golf ball can pass through the tiny little duct. And sometimes, you know, things like that do work, but in general they don't. These are things like vinegar and, you know, a lot of spices and so on that you can find cleanses on the internet. And they will definitely flush out your colon. You'll get rid of all the stool that you have in your colon. But the gallbladder probably will not release its large stones. Maybe tiny little ones or sludge might help, but not the big stones. So for the liver, it might be helpful. For the gallbladder, probably not.
All right, so stay away from the fatty, greasy foods. to keep a healthy have a healthy
gallbladder. Make sure you drink lots of water and eat your vegetables.
All right, words to live by. Thanks, Doc, for that information.
Sure.
Dr. Lom will be back again with us next week, and the topic will be hard rocks, all about kidney stones. If you have any questions, you can email them to healthyliving@KUAM.com, or of course post your question on our Facebook page or on our website. We're back right after this.